Hey friends, let's talk a little bit about substance use disorders as they really do span all ages and groups of clients that we will be taking care of. Okay, so let's start by talking about a few of the key definitions that you need to know. You may have referred to substance use disorders as addictions in the past. Substance use disorders can actually be broken down into categories like dependence and addiction. So, what is the difference then between addiction and dependence? Let's talk about that. We'll start with addiction. What is that? So, this will be a chronic issue where the client compulsively uses or seeks whatever the behavior is, no matter what the consequence is. And this actually physically rewires the way the brain experiences pleasure. So, as you can imagine, this is a pretty severe form of substance use disorder. So, now to differentiate addiction from the term dependence. Physical dependence occurs when the person needs to repeatedly use that substance in order to avoid what? Do you remember? Withdrawal symptoms. So, what is withdrawal and what symptoms might we see? So, when a client is withdrawing, they are experiencing physical consequences as the substance is wearing off in the body. This can present as sweating, anxiety, nausea, vomiting, even a fever, just to name a few things you might see. So, do you remember what the term is for the increasing amount of a substance needed to receive the same desired effect? That would be tolerance. And alcohol use disorder. This is one of the most common examples of this. Okay, while we're on the topic, let's talk about alcohol for a minute. So, alcohol actually depresses the central nervous system, which can in turn do what? Can actually slow down brain function, which can impair cognitive functioning, right? And it can lead to a number of other medical concerns like vitamin deficiencies, memory problems, cirrhosis of the liver, pancreatitis, you name it. It can cause that problem. So, clients who are dependent on alcohol and go through alcohol withdrawal can have those symptoms develop just within a few hours of abstaining from alcohol. So, how are you going to recognize that a client is withdrawing when you're performing your physical assessment? Clients experiencing alcohol withdrawal often develop anorexia, insomnia, irritability, tachycardia, tremors, and they might even develop seizures. A couple days after, they might enter a stage called what? Do you remember? So that would be delirium tremens, which is more severe and it peaks 2 to 3 days after alcohol cessation has occurred. What are some other examples of substances that can depress the central nervous system? So benzodiazepines, barbiturates, sleeping pills, all of these are CNS depressants and may be involved in a substance use disorder. What do you think we're extra worried about with an overdose of these? Okay, think back to your ABCs here. Slowed respiratory rate for sure. And a little bonus question here, just to jog your brain. If the client has a toxic level of a benzodiazepine in their system, what would be the antidote? Do you remember? So for benzos, that antidote is known as flumazenil. Now let's talk about opioids, which is a very hot topic in the US. Can you think of any examples of opioids? I know you have seen some in your clinical rotations for sure. So opioid drugs, that would include things like opium, heroin, morphine, codeine, hydromorphone, oxycodone, fentanyl. Due to overprescribing, unfortunately, we have seen a big rise in opioid use disorders in our country. Now, the biggest risk from overdose is what again? It's that respiratory depression, which can quickly lead to death, unfortunately. So, do you remember what medication actually reverses the effects of opioids? That would be naloxone. Okay, now that we have some of the basic facts around substances and substance use disorders down, what are some risk factors for this? Having an overlapping mental health condition, that is a huge risk factor. Family history of substance use, that's always a major factor. Keep in mind there is a genetic component to addiction. And then we always want to be careful of early use of these drugs because they may predispose a younger client to addictive behaviors. Of course, life stressors always increase the risk as clients are trying to cope. So this can include loss of a job, death of a loved one, really anything that is posing an increased stress or grief onto that client. And how can we test for addiction or substance use? So there isn't a specific diagnostic test that can tell us if someone has a substance use disorder. We could definitely collect urine and blood and analyze for different substances if it's indicated and if it's ordered by the provider. Some of our best tools, though, those are those simple screening assessments. Can you think of any? Okay, so two that immediately come to my mind are alcohol use disorders identification test, or the audit, or the Paige questionnaire. As we've mentioned earlier, our biggest safety concern with some of these substances, especially opioids, is of course overdose. So what can we do to help prevent overdose-related deaths? We absolutely need to educate about the risk and encourage clients with known opioid use to carry naloxone with them, as this can prevent death in case they do overdose. In these clients, education of the family or close contacts, that is also critical. We need to talk to them as well. All right, so let's finish off with some quick questions. So which of the following is an example of a CNS depressant? Alcohol, hydromorphone, benzodiazepines, or heroin? All right, what do you think? Okay, so this was totally a trick question to see if you were still awake and if you were still with me. These are actually all CNS depressants. Okay, let's move on. Let's try one more practice question to round out today's lesson. So you are the receiving registered nurse in the emergency department with a client who was brought in by EMS. The paramedic is giving a report to you en route to the hospital and notes that the client has pinpoint pupils and shallow respirations. They remain unresponsive. What are your priority nursing interventions for this client when they arrive at the emergency department? Maintain a patent airway, reverse the potential cause, place the defibrillator pads on the client, notify the family, maintain IV access. Okay, I'll give you a second to look over those and think which of these are priority actions. You can pause if you need to. Okay, so here are your answers. Hopefully you were thinking about those ABCs during this question. So we absolutely need to stabilize this client and continue to monitor fundamental care pieces. Keep a patent airway and maintain adequate breathing, of course. This client may have an oral airway or a nasopharyngeal airway already from the transport with EMS. We also need to maintain IV access for possible advanced cardiac life support or any fluids or medications that this client will need to have administered. So we also need to try to reverse what has caused this. Is it opioids? Is it benzos? A lot of times EMS will administer the antidote in the field or en route to the hospital. However, other doses might be required from us and close monitoring of the client is needed at that point. So at this time, there is no need to place defibrillator pads on the client as this is not the priority at this time. The family will be notified, but the care team will be focusing on stabilizing and correcting the issues this client is experiencing. So therefore, A, B, and E are correct. All right, everyone, that is it for substance use disorders. Happy studying, my friends. You can do this. Great job.